Thank you, Alexis. Thanks to Dr. Dirks as well for the opportunity to serve on this panel. And this is really one of the few places in the world, or a few times in the world, where you will see the variety of specialists at this table in the same place at the same time, talking about the same issues. So it's just fabulous when people from dental backgrounds, oral health, research, clinical arena, public health are all talking the same language and sharing their thoughts. So I'm excited to hear what everybody else has to say. And basically what I'm going to talk about is what everybody else is doing. But I've had the opportunity to collaborate with all these different specialists around the world. My disclosures today are, I am president of the Head and Neck Cancer Alliance, so I'll have a couple of slides. I hope they're non-biased, and I'm going to equally represent all organizations because we're all in this fight together where it's not a competitive situation. Immediate past president, as of yesterday, American Head and Neck Society, and I'm aware of the lack of awareness, and so that's what I'm going to talk about today. So we'll go through the problem, the research, the efforts, and the future. The problem is, and let me ask, how many people are from North America? Raise your hand. Thanks. How many from South America? Europe? Asia? Antarctica? Okay, that's all right. No, so that's the point. We all have different issues. So the problem is there's research, and they're almost always specific to our geographic area, our cultures, our socioeconomic factors, things like that. So if you look at oral cancer, I mean, all our work needs to be done in India, basically. I mean, if we're going to concentrate our efforts due to the numbers. The United States has a lot of literature on it. We've got to address all the other parts of the world. So tobacco and alcohol, historically, HPV, betel nut, and the different substances that people use in different parts of the country. So the problem is there's low numbers of the public know anything about oral cancer. And I say oral cancer. Sometimes I mean oropharyngeal cancer. Sometimes I mean pharyngeal cancer. Problem is very few experts use those terms appropriately. So you've got to be clear when you're reading an article, are they really talking about oral cancer, which is oral cavity, or are they also including oropharyngeal cancer, which is part of the pharynx? And obviously we know now those are two different entities, and you cannot use those terms interchangeably. And so when you're addressing an awareness problem, you need to understand what you're talking about. So we're giving inconsistent messages as experts to the public. So how can we expect them to be aware when we are talking about oral cancer? We might have the site wrong. We say tongue cancer, we're talking about base of tongue or oral tongue, two different diseases, two different etiologies, and around the world there's different causes and problems. Risk factors are different everywhere. The symptoms are different depending on the site of the cancer. So we can't say look for a red or white patch. They're not going to see that in the base of tongue. Sore throat, yeah, that's oropharynx, but that's not the oral cavity. And so there's different risk factors and signs and symptoms as well as treatment. So we've got to be very clear and very specific about our message. And if we're going to do research on these topics, we have to focus on what we're talking about and not include all head and neck cancers as a group. So there's a lack of a unified effort internationally and worldwide variations we've talked about. So part of the problem, I'm not going into this, this is a part of another talk. Part of the problem is we don't get a lot of support for preventing and detecting these cancers early. In the US, Canada, and UK, there's little or no evidence to support oral cancer screening. So how can we convince patients to go get checked if they have a symptom or don't have a symptom if we don't have support that that's going to improve the outcomes or research to prove? So really this is the strongest statement right here, that increased awareness and improved case finding are to be encouraged. And that's about the strongest statement we'll get from any of these agencies. The problem is mostly in India. And the incidence far outnumbers anywhere else in the world. 100,000 new cases per year, 50,000 deaths per year. So that's the problem. Look at the international numbers. It's going to be 274,000. So that's all countries, all different etiologies, and combining these together. So we've got to figure out, are we going to focus on one particular area? We're going to give a broad effort internationally. So in India, there's a late presentation. And oh, by the way, these are from Pankaj Chaturvedi. I have slides from Ross Kerr. I have slides from Brian Hill with the Oral Cancer Foundation, Nancy Leopold with Spunk. I'm sure there's others, so I apologize. I hope I have references in here to those. But this is a group effort worldwide that we are combining efforts to try to educate the world. So I've combined slides from all different organizations in today's talk. So what is the research? The research, you can't talk about research unless you know what the facts are. So we've got to know what is the early sign, what is the early symptom, how do we educate people to be aware if we have not clearly defined what we're supposed to tell them. People say red or white patch in the mouth. There's very little research to support that that's exactly what they're going to find first. Does awareness improve survival or morbidity? We don't know that. Nobody's ever proven that. So why are we making people aware? We need to do studies to show that making people aware of this is going to encourage them to go see their physician or dentist, get their treatment early, and have better outcomes. Till then, why make them aware? We've got to prove that. These government agencies don't care. If we're going to talk about it and not prove it, they're not going to back us for grants and other things. So that's what we need to do. We need to do more studies to prove that we can make a difference with this. So I'm going to go through some different organizations around the world. So the UK, Open Up, the Mouth Cancer Campaign from 2011. So these are some studies that have been done. And you can see the residents in this area were more likely to be aware of the campaign after these pamphlets were distributed. Those aware of the campaign were more likely to be aware of the risk factors for oral cancer. So here's a sign. These are some studies that are starting to prove that it makes a difference in awareness, but does that translate to better outcomes? Here's a Malaysian oral cancer awareness campaign from 2012, and look at the red. This is what I'm highlighting. So they did 20-second ads on 2 channels for 32 days, 2 talk shows. The awareness of oral cancer increased across gender and race group. Awareness of the signs did not increase significantly. The Scottish group, mass media strategy in 2003, awareness increased from 85 to 92%. So does that make a difference? There was an increased likelihood of contacting their general practitioner at the second follow-up, however. Detroit Oral Cancer Project, questions about oral cancer and requests for screening increased. And does that make a difference? Maryland really has one of the top studies done. This was published in 2012. So they did a model for early detection and prevention, and their data showed oral cancer mortality decreased, and that was from 7th to 21st as a state in the United States. So this is some good, hard data that may have made a difference. Now, can you say that there wasn't some other ads that contributed, or people were reading articles about this outside of this study? Potentially, but this is the data we need to show. This is a study we did. What are the initial symptoms of patients with HPV positive and HPV negative oropharyngeal cancer? The symptoms, surprisingly, in HPV positive, what was their symptom? They didn't have a symptom. They found a lump in their neck. They were mostly males, and they were shaving, and they felt a swelling in one side of their neck. They weren't having any symptoms. The sore throat was the most common in the HPV negative. So sore throat and neck mass were the most common, and this is published in JAMA online, were the 2 most common symptoms of oropharyngeal cancer. Not oral cancer, oropharyngeal cancer. So why is oral cancer awareness important? This was also just published recently online. You can see that cancer of the nasal cavity, salivary glands, sinus, pharynx, larynx, glottic, lip, all represented less than 5% of respondents recognized those. Most people thought brain cancer was part of head and neck cancer, and that headache was the most common symptom of head and neck cancer. What message are we giving to people? So we've got to be very clear on that. The respondents in this study also, they said that they didn't know much about it. In fact, 0.8% knew that HPV infection was related to oropharyngeal cancer. This is the public. So we've got to raise awareness. The case for screening, however, is much less clear. We're going to hear more about that. Very few studies that have discussed screening. This is one. The study out of India that showed that mortality was decreased in the screening group. The number of deaths were lower, and here's the graphs. Same thing for oropharyngeal cancer. A study out of Costa Rica looking at HPV infection for cervical cancer showed also a decrease in oropharyngeal cancer, first study ever for people that got the vaccine. So what are the efforts that are going on in the world? July 21st did an internet search, 1.5 million oral mouth cancer awareness hits. And we looked around to see, we took the top 100, and here's the awareness events going on around the world. If yours is not on here, send me a slide or send me a logo and I'll add it to my next presentation. But there are so many events going on, but the question is, we've got to have a unified message that we're giving people. Thanks to Nancy Leopold, all she has done for spunk and oral cancer survivors worldwide. She founded this in 1991 as a cancer survivor herself, and they have done so much with support groups and memberships, survivor networks, and publications. Thanks to Brian Hill, also oral cancer survivor, started an effort to increase dental screenings and exams and early detection of oral cancer. Now he's got so much more going on with support groups, news feeds, and education online and beyond. He's doing research and advocacy, so thanks to their organization. This is the organization I'm involved. We sponsor Oral Head and Neck Cancer Awareness Week every year. 2015, we get screening sites. The goal for the screenings for our event is not to necessarily find cancers. We do find cancers. It's to educate the physicians, the dentists, and the public that work around them indirectly via free screening. And this is a global oral cancer forum. Hopefully, Ross will talk more about that coming up in 2015. And I hope that Alexis is going to talk about the IAOO meeting, where you might see these same types of panelists in a panel together. This is more of the sponsors of the Oral Cancer Forum. So in summary, campaigns to increase awareness of oral cancer are on the rise. We have a lot more going on. They've been effective in raising awareness as well as increased screening, but we need further research to show what the benefits of this increased awareness. I encourage all of you, you guys are all experts or you wouldn't be at this meeting. The terms oral and oropharyngeal should not be used interchangeably when you're educating the public. Awareness programs should clearly define their goals and be customized to the geographic and cultural variations. And please do research that we can prove the prognostic implications, improving morbidity, improving survival because of these campaigns. Thank you for having me.